At the onset, I would like to thank Rohit, Pooja, and the whole team of NN to have given this opportunity to me. It's always fantastic to be here, lots of learning. I just thought that I'll share this video of mine. Just thought that we got a new marker made for lenticular procedure. So I had my Z4 in 2013, and you'll be surprised, this is a decentered femtoflap. I also ablated the conjunctiva. So the hinge is actually at the margin of the pupil. So what is the take home? I'm not going to talk about flap at all, but the take home here is you have to know whichever system you buy, whether it's ATOS or whichever lenticular procedure system that you're buying. So you have to understand the system very well. So here, this is the flap made by the bladeless that's now on the Z8. So if you understand that the flap is slightly decentered, this is more space here, less space here, but this is not a fear in flap-based surgery because the excimer is treating on the central visual axis. So there is no fear about this being there, but this cannot be afforded as far as the lenticular procedure is concerned. And of course, this will affect, so the decentration does not affect because the treatment is on the optical visual axis, and there is, of course, a transition zone as far as the excimer is concerned. So when we look at the applanation area in the femto-LASIK procedure, we can see the limbus, okay? So the limbus can be seen. Now, this is entirely to do with the system that you have, so the applanated area is all around, and this means in a lenticular-based procedure, normally, I got the Z8 in 2021. We know that it does cataract, LASIK, lenticule, and intacs, and corneal applications. But when it comes to lenticular-based procedures, the limbus cannot be entirely seen. And that's the reason why the centration suddenly becomes very crucial. And there is two options as far as the centration of the lenticule on the Z8 system is. Either you can have it pupil-centered or mark-centered. So we have two options in this system. So there is a possibility of auto-alignment, which is up till 15 degrees, and I'll show that in the video. So the applanation in lenticular surgery area is entirely different. So let's look at it. Now, when we start applanating in the lenticular-based system, the pupil expands, and the pupil will not expand in the same direction every time. It may move in a different direction. So if you see case 1, this is the second case. Again, the pupil expands in a different direction. So a lenticular-based procedure should not be entirely done on pupil-based centration, and that's the reason why you may get errors post-op. So the pupil spreads in any direction once the applanation happens. And this is the next case. Again, it's centered, and then again you'll see that the pupil expands in a different way. So applanated area, because you can't see the limbus as far as the lenticular procedure is concerned, perfect centration is very crucial. Now, why can't we see the limbus as far as the lenticular-based procedure is because of the camera angle inside the system. So when you're doing a flap-based procedure, the camera is seeing differently, and when you're doing a lenticular-based procedure, the camera is seeing differently. And that's the reason why I always say understand the technology that you know. So this you feel is very easy, but actually they are lying on the floor and it's just shown differently. So it's the camera angle. So you can see this, but when you see it differently, actually she's sitting on the floor, that guy is sleeping on the floor, and the other one is hanging. Again, this is a camera angle. So let's look at, so what I did was already there is an award marker in the market. I further modified it for the Z8 system to make sure that the mark is seen in the center. And this does auto-alignment till 15 degrees. So this is the marker. And the difference is that you will see 180 degrees, and you'll see it all around. So I'd like to mark towards the center, and I removed it. So once we've done that, I do an image marking. So I do a video on image guided, and then I mark the center. So the patient looks right into the center of the microscope. I got my video on. I do my marking, and you'll notice that the mark can be seen till the center. I'm not bothered about the limbus, and you can see that the mark is still right till the center. After that, we take the patient for the Z8 technology, and that the lenticular-based procedure. I put 1 drop of methylene blue. The beauty here is the dye does not affect the lenticular-based procedure at all. So here you can see there's an auto-alignment. So you can see the red lines auto-aligning with the marker that I had already done. And once that is done, I like to make 2 incisions. I'm still doing this. This is anterior, this is posterior. You can do whatever you are used to. But technically, I'm happy doing this, and I don't see any reason why I should change. the right side goes anterior directly, and the left side goes posterior directly. So all of you have seen this quite well. Once I just separate it, go in, then go from the other side, and then use the separator, the same wiper type technique. And once that is done, I go from the other side. So point here is the centration, as far as lenticule-based procedure is concerned, is quite crucial, and we know that this will affect the outcome of the result. And once this is done, go from the other side, and once that is done, you can see the separation happening quite easily, the dissection, and no doubt that the energy has to be adjusted according to your humidity and your machine. It's not that everyone on the Z8 will have the same energy. So the lenticule one, I like to somehow wash. Once the wash is done, I would also like to make sure that the basement membrane, the sweeping method to straighten out the basement membrane is essential. Now, let's look at the auto-centration. As you can see, the marking, once the marking is done, sometimes the auto-centration does not work because of this reason. So you can see here, these are the marks, and this is auto-alignment. That worked quite well. And sometimes, if the axis is more, because when the vacuum builds up, there is some amount of cyclotorsion. If the cyclotorsion happens, then you can manually do this. So you can see that the marks are in this direction because there was some amount of cyclotorsion when the vacuum built up. Now the marking can be seen quite easily. So here what we do is we manually align it. So you can see the red cross, and these are my marks, and I rotate it and make sure that it is aligned. So this, I feel, is a very good method because the image technology helps you to get the exact image in. So let us look at the post-op images. You can see that they're very, very well centered. So no doubt that the surgical outcome depends on pachymetry. No doubt that the laser energy has to be lowered to the best sweet spot you find in your system. Look for gas bubbles. Look for stromal fiber arrangement. Of course, the biomechanics of the cornea, lenticule centration, shape of the cornea, surgical area, and spherical equivalent. Anything more than this, I don't know. Please ask Rohit, because he has answers to all of it. Thank you for your attention.